Okay, so today I'm going to talk about brain injuries or the brain itself so you can better understand any kind of brain injury that uh, someone might have. So, the brain, for neurology terms, is the cerebellum, a cerebrum. Sorry, not cerebellum. Okay, cerebrum. Okay, and the cerebrum has um, four different lobes. Okay, the frontal lobe and the per, I'm reading this. I'm just going to name them parietal, pari, parietal lobe. Sorry, the occipital lobe, and the temporal lobe. Okay, those are the four lobes that are in your cerebrum. Okay, so it depending on which one is damaged. Now, each of these lobes also have parts to them. So each lobe, say temporal lobe, has, depending on the lobe, however many parts are in there. Each part of this brain or of this uh, of your lobe controls certain parts of your body. Okay, so like the frontal lobe. I'm just going by what Carl has, but this is real easy to get online. But I'm just trying to help you understand. The temporal lobe, which is right here, he got hit, on the front side of the frontal lobe, and this frontal lobe controls personality, behavior, emotions, judgment, planning, problem solving, speaking, writing, body movements, like, motor skills, intelligence, concentration, and self awareness. Okay, so Carl's personality, it's there. It has definitely changed from what it was before. Before he was not so happy, and now he's a very happy boy. He's very content. His behavior, from what we can tell, is different. Also, emotions, he still has them. He just shows them in a different form, and we'll go over that once you meet Carl. His judgment, of course, he doesn't have any. Planning, he doesn't have to do that. Problem solving, he doesn't have to do that. Speaking, he does not speak. Uh, his larynx or his voice box, you have one on each side. Um, One of them might be partially paralyzed from when they intubated him. Uh, but other than that, there's no reason why he doesn't speak except for the damage. Um, Writing, he can write. He can write his name, um, but he doesn't remember everything. So that's another part I'll get into. Body movement, he can do all that. But because of lack of therapy when he, immediately after he had the accident, it's what they call paralysis, which means he doesn't have the muscle tone to be able to move as much as we would like him to. Intelligence, he's extremely intelligent. He just doesn't show it in the way that people would think him to. Concentration, he concentrates. He definitely concentrates. When I try to get him to do something, he will concentrate. And self-awareness, he knows he's there. He wants everybody else to know he's there too. The other two lobes, occipital, I'm sorry, and the parietal, I'm not going to go over those, but those also have certain sections in them for other things. So now his temporal lobe, which is right here, more kind of like that, it got hit, damaged. So the temporal lobe is understanding language. Uh, it just a certain little part. Memory, which we don't know what he memorized, what he remembers. I know he remembers people, voices especially. He remembers that. Hearing, he can hear because, like I said, he recognizes voices more than he does faces. Sequencing and organization, of course, he doesn't need to do all that because we're doing it for him. Um, so at this point, there is also the right and the left of the cerebrum. Okay, and so here's the thing: like the parts that are damaged in Carl's head, when he first finally started moving, he's right-handed, but he started moving his left hand first. He could move it, and we had him doing numbers, and his little brother taught him how to give people the birdie. So when he got mad, that's what he would do. I don't think he understands that it's bad. I think he just understands that it means I don't want to, or something like that. um, Thank you for his little brother for doing that. It's very embarrassing, but it's funny at the same time. Um, but he was doing a lot of that. He could catch a ball when it was rolled to him. He could, you know, make it stop, and he could even roll it back. Now, the arm started moving a lot. It was doing a lot of stuff. Now, here's the thing: years later, his right arm, his right hand and arm started to follow suit. Now, his right hand is not as good as his left hand, but it still does things. Oh, gosh. Turn that off because it's glaring in my glasses, driving me crazy. Okay, so now his right hand is moving a little bit. Um, I guess I should at this point go to, because of these things. Now, a lot of people can have a brain injury and go back to normal, like Gabby, that congresswoman that did. The thing is, you have to have immediate immediate therapy. And I don't mean just moving them up and down, and that's called range of motion. That's not what I mean. I mean strengthening, comprehending, uh, having, eye hand coordinations, hand to hand coordination, stuff like that. Carl has no hand to hand coordination. Um, Not really sure. I'm sure if he had therapy more often than not, he could have that better. Now, once you figure out what part is damaged, and you're really not going to do that until therapy starts. Now, here's the thing: when we got out of the surgical floor, we went to an inpatient rehab in the hospital, and this is what they were supposed to do. But because they thought he was a vegetable, they didn't. The only reason we went to that rehab was so they could teach me how to use the Hoyer lift. A Hoyer lift is what we get him into, like a swing, kind of, and get him in and out of bed, like into his wheelchair and into his bed, vice versa. That's the only reason they sent us there. Go figure. Of course, while he was there, he got deathly ill again and had to send him to another floor to recuperate from that. And from there, they sent us right back to the rehab, which drove me crazy. So anyway, when it's time for therapy, you make them do the therapy. You make them do. I don't care what they think. I don't care if they think he's a vegetable or he's paralyzed, or I really don't care what they think. They're not going to know what that person is capable of until they try. Until they try. He should have had physical therapy, which is the legs, occupational therapy, which is the arms, speech therapy, which is, comprehension and talking and stuff like that. They should attempt to do all of that, every day. Every day, one or the other, or all three, depending on the person. Carl would get very tired easily, so he would just have one a day, um, when we went back, and see if I feel. In fact, I've read quite a bit about this, that if they had started therapy right away, things would have came back quicker. It's just like a baby; they learn faster, you know. But if they wait until he's been, not doing anything for a while, then he's gonna forget. His brain's just gonna, it's not gonna try to get better. It's just gonna get smaller and smaller. Is the only way I can think. It's kind of like a cartoon. You blow it up, you blow it up, you use it, and it gets better. If you don't use it, it just kind of shrivels up and I don't want to say die, because Carl could probably still be capable. It's been 10 years, but if he had, you know, reasonable therapy, then he could probably get better. And I don't care how much you have to fight with these people. I really don't. Um, and you shouldn't either. This is your child, your kin, whoever. If you're the one, the advocate for the person, then you shouldn't care what they think about you. It took me almost 2 months of wear and tear on me and my son, and watching what was going on and everything before I blew up. I finally got angry and yelled and screamed at this nurse. This was during the time they had to take him back to another floor because he got ill again. He was coughing up blood through his trach, uh, and he was soaking wet. His bed was wet, and I had asked for sheets to change him, an hour and a half previous. And then they called the doctor because he was coughing up blood, and all the doctor did was stand at the door and say, "Do they have room for him over there on the other floor yet?" I couldn't take it anymore. I think it was 2 months at that point. So anyway, when you're in the rehab, or even if they don't want to send you to rehab, you demand it. Demand it. You do not have to leave that hospital until you are satisfied. And if you're not satisfied with what he has accomplished or what the person has accomplished, that they have done the most that they can do, then you demand that he go to therapy. Demand that they go to therapy. And I didn't do that because I didn't know you could. I didn't know you could. And I wish I had, because if they had started therapy sooner, then he probably could have gotten a lot better than what he is right now. It was 9 months, it was almost 9 months when something happened. I had met some kind of caseworker. I think she was a rehab caseworker at the hospital, and we made an appointment for a neuro rehab doctor. Now, the neuro rehab doctor said, "Yeah, we need to start therapy right away," because he was moving his legs, his left leg a little bit, and he could move his left arm a little bit. And she said, "We'll give him a couple of drugs. One of them was for alertness, to keep him awake during the day, so he didn't get his days and nights mixed up. And then the other one was for nervous disorder. A lot of brain injuries will hit certain nerves, and they'll shake. It's kind of like Parkinson's disease. They just shake uncontrollably." And so she gave him that also, so they could determine what he's actually moving and what is just shaking. So that would stop the shaking, which it did, and he's gotten a lot better. Now, his eyes were shaking also. They call that stagma, when their eyes shake. Now, after 10 years, it doesn't do that anymore, but he still doesn't quite focus um, quite as well as anybody else. Um, but when you're in the hospital, demand a therapy, and I don't mean range of motion. Range of motion is good. That's what they were doing with Carl, almost the whole time he was in the hospital. But I want real therapy. I want you to see what he can do and what he's capable of doing. So anyway, 9 months we met the neuro rehab doctor, and she demanded he start doing therapy. And he was doing so well in therapy. It was amazing that the very first therapist, she's the one who had him catching the ball and rolling it back. She had him talking actual words, just one or two, but it was a start. It was a start. And so and then she left. She got a job in another city and left. So then we ended up with another therapist who, Carl didn't seem to like her very much, but she was good. He's did flip her off once or twice. Um, Embarrassing, but that was the only way he was getting himself across. But she's the one who had him counting with his fingers. You know, she'd ask him, how much is three? And he would hold up three fingers. How much is one? He'd hold up one finger. She had him doing that. And that just shows he comprehended. He comprehends. He understands everything. Um, and then I guess it was a, a year and a half after his accident. This neural rehab doctor, I don't know how she did it. I think she pulled a few strings and actually broke a few rules. But she got him back into the rehab, the inpatient rehab. And there I was able to stay with him all night long, all day long. And they had him a schedule. Every day he had a schedule. They posted it for the whole week. And so they started therapy. And I kid you not when I tell you, we would go into the gym, and the first day was no big deal. We got Carl onto the table with the Hoyer lift, and they, did a few things. And once he realized, oh, I can do this, and oh, I can do that, he would start to do stuff. When I kid you not, by the second day, and he would do his physical therapy and his occupational therapy, sometimes at the same time, sometimes separately, and then speech was in a whole nother room. But I kid you not when I say Carl would go into that gym, and every therapist that was in there was trying to work with their patient, but then looking over their shoulder at Carl and seeing what he was doing. Everyone was so amazed at what this boy was accomplishing. So amazed that he could lift his arm over his head. So amazed that he could hold his head up. Amazed that he could pick his leg up to where his knees were up. It was just amazing what this boy could do. They put him on a machine where you push with your legs and it makes your body come up, and then you let go and it goes back down. He was doing that. He was doing that. They lay him on his back and he was picking his hands up over his head, or not over his head, but straight up as he laid on his back. It was just amazing what he was doing, and everybody wanted to work with him. All the therapists wanted to work with him, but the it was actually the girl that had helped teach me how to use the Hoyer lift with Carl is the one that said she saw his name and signed up to be his therapist right away. And so it was thrilling for her to see him do that stuff after thinking he was going to be a vegetable. Um, it was amazing. It was just so amazing. I have videos of, and then there was one time they put him on a cycling where you do the hands and the legs at the same time. Now Carl, he couldn't hold on, so they had to get some bandages, ace bandages, and tie his hands and his feet to the pedals, and you can make the machine start it. You make the machine do it and at a certain pace or whatever, and it'll start going for him. But he figured out what it was doing and started doing it itself. The machine was like, he's overpowering the machine, kind of like he did with the ventilator. He started fighting with the ventilator and started breathing on his own, and the ventilator wasn't breathing the way he wanted to, and so they were contradicting each other, and so they had to take him off the ventilator. So that's kind of what he was doing with this machine. And I have a picture of like 6 or 7 therapists standing around him looking at the machine, saying that he was the one pedaling, he was the one moving his arms, and he was the one pedaling the bike part of it while he sat there, and they were all just totally freaking out, totally freaking out. So therapy is so important. It's so important. I don't care if they think he's a vegetable. I don't care if they think he'll never move. Like I've said before, doctors know everything there is to know about the brain, as I showed you, except for how it works. Okay? And because, like, there's the right side and the left side. Um, I personally, because I've read about this a lot, think that part of the left side of the temporal lobe or the frontal lobe and temporal lobe, I guess, started working for the right side of the frontal lobe. And same with the temporal lobe, it's more elongated like this. I think one part started working for the other part. And so that's why Carl's able to do a lot more than what everybody thought he could. I think the brain started working for the other parts that weren't working. That's why he didn't move his right side for the longest time, because the left side wasn't working. And then lo and behold, there it goes, it starts working. So, I mean, I don't care what the doctors say. Don't make excuses. Just tell them, just try it. Just try it a couple of visits and let's see what happens. Because they didn't do that with Carl, and I still think that if they had, that boy would be walking today. And I'm going to end it at that because it's been 20 minutes, and I said these wouldn't be very long. So anyway, I'm going to end it, and we will see you all next time. Maybe we will meet Carl next visit. We'll see. Thanks. Bye bye.